Anna, how are you?
I'm good, thank you. How are you doing?
Thank you. It's a pleasure to meet you. So today I would like to talk to you about Cara Health.
Yes, I'm looking forward to it.
Could you share a bit about your journey before Cara Health, especially your experiences as a nurse?
Yes, happily. Exactly. So I'm originally from Germany. I trained to be a pediatric nurse approximately 7 years ago. My specialty was in intensive care for premature newborn babies. And during this time that I was training and working in one of the biggest hospitals in Germany, at one point decided I just don't want to see just the babies when they're actually born and in hospital, but I was very interested in the journey beforehand, but also then afterwards, and the one that maybe isn't happening in hospital, but the natural birthing cycle. So I was very fortunate to be able to go to Canada and work with a midwifery clinic in Canada for some time, and experienced my first birth there and the regular postpartum period of women and families, and really caught fire in that. Went back to Germany and then decided to go to Berlin to the Charité, and I worked there for a year on the labor and maternity ward and postpartum ward. So very closely with women and families during this whole period. So that was my nursing journey before I moved to Estonia 3 years ago.
So what was the aha moment that you led and your co-founders to create Cara Health?
So I met my co-founders approximately 2.5 years ago. So half a year after I moved to Estonia, and we were working on something quite different. It had something to do with helping women with the breastfeeding journey, but we discussed different maternity systems, so the Estonian and especially the German maternity systems. And what we found out is that there was quite a difference in the postpartum care by these systems, and that in Germany, the government pays for 16 postpartum home visits in the first 12 weeks after birth. And in Estonia, they were not happening. And we couldn't really actually comprehend why this was the case, and tried to understand this much better from the actual system here in Estonia. So we networked with a lot of medical specialists here in the field, everybody from a gynecologist to a midwife, anybody who had a touching point with the woman and the family during the period, and actually noticed that they were really missing this as well. And what we, however, learned is that, and I felt it very closely because I was in the system before as a nurse, that you're a bit stuck in this traditional medical field and you're not really able to make a lot of changes or innovation because you're just working and you're helping the families and the patients. And so this was an aha moment, I think, when Kyle, Karina, and me decided, you know what? We are going to do it. So that's how Cara then started 2.5 years ago, that we said, okay, we're going to do something and firstly bring these postpartum home visits to women in Estonia.
How did you meet with your co-founders?
It's quite an interesting story, and I think that was one of my biggest learnings to that point. I wasn't never really extroverted as a person. My co-founders, Kyle and Karina, had a business before Cara, a very successful business that they built for 5 years. So they've been entrepreneurs for that time as well, and they had a very pretty logo on one of the buildings here in Tallinn. And I reached out to them and said, you know what, everything that you do looks super great, and let's do something together. So I became kind of like more extroverted in that sense and reached out to them, and that's where the journey then took off.
And how did you validate the need for the platform like Cara Health in the market? As you mentioned earlier, asking doctors and also looking for to demand. How did you validate it?
Yeah, I think so. The background a bit is that Cara firstly didn't include technology. Firstly, it was a space in Tallinn that offered comprehensive services to women and families during the maternity period. So pregnancy yogas, midwife appointments, family schools, so everything evidence-based but educational. So from education basically over wellness, but also to fitness and sport. And we in that time had over 250 women coming to us in the first few months. And we really tried to understand what these women want or need during the maternity period. And because we were bootstrapped to that point, we were working in my co-founder's previous business, which is a baby shop. And so what happened is that women came to our services and to our midwives, and afterwards normally, came to the shop to get something nice for themselves or the babies. And we would just be super interested and talked a lot to them. And in this point, we really had 3 key learnings that then enabled us or empowered us in a sense to create Cara with the technology, with the app behind it. So the first key learning was that when we were talking to women, we understood quite quickly that they often didn't actually know what would help them with certain situations or symptoms during pregnancy, but also after. So this would not enable them to actually go on the internet and search for something, because you can't search for something that you don't know. The second learning was that the maternity system, not just the services that were happening for women during this period, but also everything else was super fragmented. So we found a study that actually showed that on average, a woman who is dealing with one pregnancy symptom uses 12 different resources to just find one solution for one of the symptoms. But there isn't just the one solution for all of the women out there, of course. And what was even more interesting was that these 12 different resources, there weren't 12 different Google articles, but the study showed that one resource was a pharmacy, the other resource was an app, the other resource was maybe a midwife appointment, a product, a shop, something like that. So very fragmented in the whole lifestyle of the woman. And out of that, the third key learning came, and that was that these fragments were also not communicating with each other, which created a lot of errors for the woman in her health, but also in her lifestyle. So what would happen is that women would come to our midwives who were the best in their field, like very specialized in the knowledge and how they cared for women. And they would say, hey, you should take some vitamin D supplement. And the woman would then go to different places to find the best vitamin D supplement. And we heard a lot of the story that there was a vitamin D supplement out there that said, you should take me the supplement 3 times a day. And then a regular person thinks, I'll take the last one with my dinner at night. But everybody from the medical field and the midwife would have known to say, you shouldn't take vitamin D past 3 p.m. because otherwise it interferes with your sleep. So actually it created so much more errors in the long run for the woman that these fragments were not communicating. So at that point, we said there must be a platform out there that combines all of the essential resources that a woman needs to just guide herself through this maternity period. And so we did the market research in a sense behind that and found that there wasn't any platform that combined these essential verticals. So we wireframed the app together. We tested this with the woman. I think at that point we probably had over 500 women coming to us. We gave them the MVP. We said, try it out. What do you think? So we got direct user feedback from the woman who actually came. They were giving very, very constructive feedback. So it wasn't just like, this is great, but actually said, you should add like this feature or maybe take this away. So it was very productive. And yeah, then we launched our app in Estonia and March 20.
What was the initial challenges you faced while establishing?
I think the initial challenges were because we started in Germany. Because we started in Estonia, women were not really used maybe to the services that we offered. So they weren't really used to midwives coming to the home or to a platform like an app to actually combine, the knowledge that you should have, the services that you should use or that can really help you, and also a product. So I think it was this new thing that we created that just needed some explaining why it's really good for the woman. And so it just took a bit of time to explain it. But once the user understood the value behind it, that it saves a lot of time, a lot of resources, then it was quite easy and clear for them.
You mentioned about it was a platform and it wasn't a technology-based service in the beginning. Now, what role does technology play in delivering Cara Health services to its users?
Mm-hmm. Right now, and this is like the part that we're so excited about, is that this app can actually reach women and family globally. globally and support these also globally. So we have now together 3 different spaces. So we have a space in Tallinn, in Tartu, and we opened one a month ago in Berlin, our first in Germany. And these spaces, they create value for us because we do market research, we understand what women want, we test, but also these spaces enable us to, for example, live stream classes to women globally via the app. So here again, the app is an enabler to reach women globally, give them the knowledge, give them the feeling of being part of this community that we're creating. So the technology really enables the reach. Plus, of course, a woman who maybe lives in Estonia or close to Tallinn maybe can't always have the access to us and our services. Firstly, from reach, maybe where she lives, but also from the funds wise that you have maybe as a family. So here again, the technology actually enables access. It's a free version. You can just use it and read about articles and understand what would help you. And I think this is the main part, that it is accessible to women globally, which is super awesome.
What does you differentiate yourself other players in the Femtech market? Are there any competitive startups in the field?
So we do have players in the field that do have 1 or 2 verticals that we offer to the women as well. However, there so far has not been one technology or one startup that tackles this hybrid model of maternity care, and we call it the maternity ecosystem. So having the spaces, but also the technology. And if we just go based on the technology, we also have altogether approximately 4 to 5 different verticals in the app that supports the woman. We call it in a whole woman approach. So there's definitely some players that have 1 or 2 of the points that we have, but we say mostly in Europe, we're quite unique in that sense.
How do you ensure the quality and accuracy of the information and resources you provide on the platform?
Yeah, here our spaces come into account again, because we have medical specialists in our team. So firstly, the app has been always developed together with medical specialists. So one being myself, but we also have a medical board of 2 doctors. One is a family doctor, the other a gynecologist. And then we have a team of also midwives as well. So everything that goes into the app is medically verified by our gynecologist, or it's written already by a midwife or somebody with the medical knowledge. But that is like firstly article based, but also all of the services, the products, the podcasts that we feature in our marketplaces, they are also medically verified. So everything that is in the app is accurate. And that was super important to us, because we found research that the top 10 pregnancy apps in the App Store, 70% of those were not even evidence-based. So, women were consuming information that wasn't actually really correct, or, had some gray areas. And we said, okay, we want to have a face. That's why we have the spaces, but we also really value the credibility and the medical part in that.
Explain the business model and your revenue streams.
So this is one part that we really enjoy. Actually, it's not a regular app revenue stream in a sense of a company that we have. We do have our premium version in the app that women can access for $6.99 a month, but we also have 2 other income streams. And one is the income stream of services. So of course, in Tallinn, Tartu, and Berlin, we do get the service revenue that we offer to the woman. But we also have this service part as a marketplace. So we get commission from services that we refer to the woman. Then we have a product marketplace, and here it works exactly the same way. So we earn money when we refer a product to a woman. So altogether here we have 3 income streams that we earn from.
And what strategies are you using to acquire or get new users?
Yeah, I think this is very interesting, as we have these medical specialists, these midwives who work with us, the doctors, the gynecologists, and it's a lot of word of mouth that happens. A medical person who really likes a product will always recommend that to the woman. If the medical person knows that it is verified, it's medically accurate, they will be super happy to give a woman a tool to hand to support them during pregnancy. And also our technology really actually helps the medical people in their work and enables them to be more efficient to a certain point. So I think mainly it's a lot of word of mouth that happens in this user acquisition.
How do you measure the success and impact of your startup?
I think this is a great point. So far, impact is the direct feedback that we get from the women that we have supported so far. We daily get feedback from women saying that the technology helped them really. We have supported over 1,000 pregnancies in Thailand alone. So I think this is something that we have seen, but we want to upgrade this. So with the funding round that we closed now and in future, we really want to be able to conduct little pilot studies, conduct studies that actually show that the information that we offer to the woman via the technology really enables them to have a better pregnancy journey, postpartum journey, and also a better outcome in that sense. For us as a company, success, of course, you see when your user numbers grow, that is something super awesome. But for us, yeah, it's just sometimes it's the little parts of success when you see a woman and writes feedback and says, you know what, this really helped me. So it's a lot about the big mission behind it.
Did you secure your initial funding, and what about the Terra VC? How did you meet with them?
Terra VC, we actually, before we closed that funding round, we had contact with them for a whole year. So it was a longer journey beforehand, because I guess the Estonian ecosystem or the startup ecosystem, investor ecosystem is quite small. So you get in contact with people quite quickly. And we participated in a pitching competition where Terra was in a jury. That's how we initially got in touch with them. And once we started to close our round, I think we picked up again, and they were happy about the mission. They saw that, you know, the business, especially with the technology aspect, will be able to be a scalable global business. And yeah, that's how we got together. And the funding round beforehand was an angel round. So we have 5 angel investors from Estonia who joined us, and yeah, they were super awesome and really in it for the mission at the beginning, I believed, and yeah, got some other people along the way as well.
Now in Germany, what are your plans for expanding into new markets or demographics in the long term?
I think exactly. We expanded now into a second market, into Germany, with opening a space there. So these spaces enable us to have a face for app users to understand that we are real people behind what we do, and again has a credibility aspect. We do believe that we have the opportunity with the app to scale quite quickly in Germany, because these spaces also enable us to reach women globally, virtually via the technology. And then I think for us, we see as next market, once we speak more in Germany as the German-speaking DACH region, so it would be the other two as well. But then we also see great potential, for example, in the UK, in their maternity market, that there's a huge demand for some additional support for women and families there. So these are definitely our first big parts.
What are the most significant trends you see shaping the future of Femtech?
There was a really interesting study from McKinsey just done, I think, three months back. And it said the first one is that there was a trend previously, a few years back, that customers would buy everything that says it's natural. But now people want everything that is medically verified. So I think that is a big trend that we were picking up quite early in our journey. The second part was the home monitoring, so that you have a technology or wearable device, something that you can actually see or help yourself at home and don't always have to go to a doctor. For that, again, it was super interesting to see, because we developed our health diary that personalizes the journey of a woman in our app. So we see that this really has a big impact. So I think it's a lot of these points. And if we go into these wearable devices or home tracking, there's a big part of AI, of course, as well in it, that then, gets you suggestions better or more personalized. So I think these are the three biggest points. in that sense.
What are the biggest lessons you have learned throughout your entrepreneurial journey?
Yeah, I think a big point, patience. Patience. You have to be patient. Sometimes things just take a bit longer. You have to be adaptable to situations. But I think the most important point is actually if you have a mission and you feel very strongly about this mission, that the actions that you take, as long as they align with that mission, it will work out and actually bring you the results in the end. So I think these are my three favorites.
How do you stay motivated and resilient in the face of challenges?
I think in terms of resilience, it's that I have two co-founders. So I think the three of us are very lucky that we get along really well. I think we're really fond of each other and on personal level, but also on the skills that we bring to the team. So I think, if one or two of us is not really motivated or we're having a bad day, there's always one person in the team who has a good day. So I think that's really awesome to have. And motivation, I think, is just because we truly believe that we can have a huge impact, that the technology and the concept that we're building will be globally scalable, to a sense that we can build a real great business case out of it. And then I think it comes back to seeing and getting feedback from actual people who say, you do a really great thing, and it helped me and my family a lot. So yeah.
What are your passions and interests outside of your work?
That's a very good question. I think there's not too much, because I'm by person and by passion just a real medical nerd in that sense. Like, I love to read studies in my free time. I'm just so in the topic. I really, really enjoy it. But I'm also a real family person. I enjoy spending time with my family, which is a bit harder now that they are in a different country. But I really think that the biggest part of my life is the whole maternity journey and how you can make it better and more innovative and data driven. So, yeah, I'm nerdy in that sense, I guess.
So what is your ultimate goal for Cara Health and yourself?
I think for Cara, well, the ultimate goal is to become multi-million company, right? I think we are able to achieve that with the unique business model that we have, and I think we're on a good way to do that. And I think that comes along with the mission that we're behind, with having the impact on life. But, the further we scale, the higher we scale, the more women we are able to reach in that sense. So yeah, it's a global reach for the company. And personally, I would love to see that we have an impact also on the medical field a bit, to show that there is room for innovation, that it doesn't have to be so traditional. So that would be probably something personal in that from my medical side that I would really wish for.
Anna, thank you very much for your feedbacks and insights about Cara Health and yourself. And thank you very much for attending the podcast of this episode.
Yes, thank you. Thank you so much for having me.